Welcome, everybody, to the Initiate Justice event on the COVID-19 vaccine. As Lee had mentioned a little bit earlier, we're really excited to have the opportunity to share the information that we have about the COVID vaccine. This pandemic is something that we have never seen in our lifetimes, and hoping and praying that we never have to go through anything like this ever again. There are so many people who have passed away, and it has particularly impacted our loved ones who are inside. And we know that there are a lot of questions about the safety of the vaccine. So we just wanted to have the opportunity to open up this conversation with folks so that you can, share the facts. So what we'll be doing this evening is Lee and I will open up with introductions and, talk a little bit about why the COVID-19 vaccine issue is important to us particularly. And then we're actually going to show a little 20-minute video that's called Coronavirus Explained, the Race for a Vaccine. It's a little documentary that was put together by the media company Vox, and it's really good information on how the vaccine works. It's where I learned, most of what I know about vaccines. So hopefully it'll help break it down much better than Lee or I could, since we're not doctors. So that being said, I do just want to, offer the disclaimer that we are not medical professionals. We are not going to, give any medical advice. We are only the experts of our own experiences. So we're just going to go ahead and share the experiences that we have. And after we show the short documentary, we'll have about 15 minutes at the end for Q&A, and Daisy will be running the Q&A box. So if you do have any questions, go ahead and drop them in the Q&A box. But I'll start with introducing myself. My name is Taina. I'm the founder and executive director of Initiate Justice. My pronouns are she and her. And I am also a participant in the Pfizer/BioNTech vaccine trials. We'll learn a little bit in the documentary about, how the trials actually work. But I was one of about 40,000 people who participated in the last stage of the trials. So for every vaccine that's being tested, they have at least 3 phases, where in phase 1, they test on a small group of people. And if they show that there's no serious side effects, they'll test on a slightly bigger group of people in phase 2. And then in phase 3, where I participated, they will test it on thousands of people. And it's only after a vaccine has made it through all of the phases and is approved by the FDA that it is shown to be safe for a diverse group of people that it is distributed to the public. And that is where we are now. It's been tested on tens of thousands of people, and now it's been approved and it's being distributed because for the most part it's shown to be safe, and it went through all of the same practices and protocols that every other vaccine has to go through. To say a little bit about my experience in the trials, they were great. I worked with many different doctors and nurses who answered all of the questions that I had. I went through a pretty strenuous screening process beforehand to ensure, that I was healthy and I haven't contracted coronavirus before. But they also, asked information about my race and demographics and everything like that, because they want to test a diverse group of people to make sure that it will be safe and effective for all different types of folks. So yeah, I got my first shot in the beginning of September of last year, got my second shot 3 weeks after that. Something else I should have said, the way that they do the test is about half of the group gets the real shot and about half gets a placebo. And they do that to test to make sure that, people, if they're reporting side effects, it's because they actually got the vaccine and not just because it's in their head and they're convinced that, they somehow got some serious side effects. But then they also look at the placebo group to see, how many of those people got coronavirus compared to the people who got the real vaccine, to prove that the vaccine can actually prevent you from getting coronavirus. So after going through those trials, it's just vaccine is shown to be about 94% effective. I should be finding out within the next couple of weeks whether or not I got the real shot or the placebo. Personally, I feel like I got the real one because the side effects I experienced seem pretty similar to what other folks are reporting now that the Pfizer vaccine is being widely distributed. My arm was pretty sore. It was kind of hard to move it. I felt a little bit, tired and fatigued. But other than that, it was great. And the last thing that I'll say before I pass it to Lee is another reason this issue is really important to me, and medical safety is important to me. Is also speaking as a woman of color, as a Puerto Rican woman who we have been experimented on in the past by the U.S. government. Folks might not be aware, but in the 1950s, the first birth control pills were tested on a group of uninformed Puerto Rican women. So I wanted to also offer that caveat to say that medical safety is very important to me, and I understand the history of some of the more questionable things that the U.S. government might have done to communities of color. But that being said, this vaccine, in it's my belief, and the science behind it confirms that it's safe, it's effective, and it's something that folks, should feel confident getting, regardless of what your background is. So I'm looking forward to having a more in-depth conversation about that. But that being said, I'll go ahead and pass it over to you, Lee.
Thank you, Taina. So everybody, my name is Lee Gibson, he, him, his. I'm the inside organizing manager here at Initiate Justice. So my responsibility is I interact and engage with 160 plus inside organizers on a monthly basis, whether through phone calls or through mail. And the reason that this webinar and education around the vaccine is important to me is because I have so many friends in there. I'm formerly system impacted, and I was in there for quite some time. And literally, I've had friends that have died from not having the vaccine available to them. There's been a total of confirmed over 45,000 people inside that have been that have contracted the virus, and over 170 deaths as of to date. And so I'm losing my loved ones. I'm losing my family members. I'm losing the people that I care about, the people that I used to walk the yard with, the people that I would engage with on a daily basis. They're calling right now. And these are things that I take to heart, and I want to be able to make sure that they got the most up-to-date information as possible to make a decision for themselves. And so, like Taina said, we're not doctors, we're not professionals when it comes to this, but we do know that it is important for people to be able to have access to the correct information. And this is why we wanted to do this webinar right here, to be able to share some of the information that we've learned, to be able to share a little bit about our lives and about our stories, and to be able to share what we feel is important to be able to make the best and most informed decisions that the folks, not only you can make, but for your loved ones when you start to share information with them and what you've learned. And so that's really it in a nutshell. It's my honor and my privilege to be able to speak to the folks inside on a daily basis. And like I said, I speak to many of them, and these are the same things that I talk to them about. And so I'm looking forward to being able to open up space with you all right now, and to be able to talk a little bit about what's going on in our climate and what's going on with the vaccine. And let's start to put some of these myths to bed, and let's start to get better educated and informed, and share your stories about your experiences with the vaccine and how it's affected you, or how it's affected your family members, so we can all as a community make the most informed decisions that we can for ourselves and for our loved ones and for the people that are around us. Because if I don't take the vaccine, that means everybody that I'm coming in contact with, that I'm putting at risk because I haven't taken the vaccine. It's the same thing with the folks inside. The ones that are taking the vaccine, they're caring about not only themselves, but the people that they're coming in contact with, and they don't want to infect them or spread it to them either. So so that's it. So I'll pass it back to Taina, and let's get this party rolling.
Thank you so much, Lee. So I'm going to go ahead and share the short video. Again, it's called Coronavirus Explained, The Race for a Vaccine. It's on Netflix. So if you have Netflix, anybody can go ahead and see it. But it's a really great piece that like explains like one, just like overall how vaccines work and how they've been able to develop this one so quickly and what the testing process has looked like. I do want to say this documentary came out, and I want to say like June or July of this year. So it's still talking about like the process of creating the vaccine and doesn't have up to date information on since the vaccines have been approved. So. All right, everybody, welcome back. I hope that you all enjoyed that. I really like that video. I learned so much watching it. So yeah, I think now we're gonna go ahead and open it up for questions. So if you do have any questions or thoughts or reflections, for myself or Lee, um, about any part of the vaccine efforts, or anything about our experiences, please feel free to go ahead and drop them in the chat, and Daisy's going to be managing the questions for us. But while the questions start to come in, Lee, was there anything, did you want to like maybe say like any reflections that you had after watching the video?
Yeah, thank you so much, Taina. And I think it just like watching this video just like reiterates to me about like how important it is not only for us to be able to have the vaccine for everybody that is in our community, but the community that's often forgotten. And those are the people that are behind those electric fences and under the gun towers. And so I know that like every day that I get the opportunity to be able to like talk to them inside, and it's super important to them. They're scared, they're frightened, they're not able to have contact with their families. There's not a whole lot of information that they're getting, and the information that they are getting from the guards or the medical staff in there, because of historical reasons, they often don't trust. And so it's important for us to be able to utilize our platform that we actually have to be able to disseminate the information that is going to be most useful to them. And um, watching the video, like I didn't understand the different phases, and I didn't understand the different stages of vaccines, and I didn't understand the different generations, and how one is a virus that they're actually introducing and this one isn't, right? It's completely different. And so it's disheartening that they didn't continue on with their study when they had them with Mars and SARS, and to be able to kind of expedite this ability that they would then have to be able to like come to a vaccine and get it approved for the public quicker. So like thank you so much for even bringing this to my attention, Taina. And I look forward to sharing every day what I've learned with the folks inside. And we sent in a 5-page or a 4-page FAQs to our 160 plus IOs just recently done with the Amend organization, and a lot of other organizations signed on to it too, because they need to hear from y'all. They need to hear from their family members. They need to hear from people that they trust. And so, I just appreciate being able to be that vehicle to be able to share with the people that are inside.
Yeah, and I don't see any questions coming in yet, but maybe I'll take a little bit of time to share some of like the common questions and concerns that have come up, and that I kind of have seen like on social media. A common misconception, or I guess like a concern, is like how were they able to create this vaccine so fast? It must not be ready yet. But I think that the video does like a really good job of breaking down like exactly how it was able to be created so quickly. And specifically, like this video didn't talk about the Pfizer and BioNTech vaccine that actually ended up making it out of trials before the Moderna one. But it's the same kind of vaccine as Moderna, and that's one of the reasons that they were able to create it so quickly, is that it's actually not a part of the vaccine. So of the virus. So they didn't have to grow a part of the virus, which tends to take more time. These vaccines are just a part of messenger RNA, which, like the video explained, is just instructions. So it's just letting your body know, like, hey, if you come across this virus, this is what it looks like, and these are the instructions on how to fight it off. So it's really exciting because this is the first time that vaccines like this have been approved for use. So yeah, we're really living in history.
We actually did have somebody drop a question in the chat, Taina, and I don't know if you or Lee would be able to answer this, but the question is, with the trials having been run simultaneously instead of back to back, are there not concerns about potential long-term side effects that we have not had the chance to see develop in trial participants yet?
Yeah, my understanding of that is that the reason that there aren't any serious concerns is because they had already been doing research on similar coronavirus vaccines. So, MERS and SARS are also different strands of a coronavirus. So, this isn't the first time that we've had a coronavirus pandemic or epidemic. So, they were able to use some of the research and information that they had from like existing trials to be able to, kind of like expedite the process.
And then this is a question actually I have, and that I'm curious to learn is, if somebody already had COVID, should they still get the vaccine? What are your thoughts on that?
For sure. So I think, yes, you should definitely get the vaccine, even if you already have had COVID, particularly because COVID is shown to be a unique illness in which you can get it again. There have been like many documented cases where people have gotten sick from COVID more than once, and there are different strains of COVID that are starting to evolve. So also, like as the film said, it's not going to be 100%. So even if you do get the vaccine, it doesn't mean like, great, I'm not going to get coronavirus, I don't need to abide by any safety protocols. No, even if you get vaccinated, continue to wear a mask, continue to practice social distancing as much as you can. This pandemic is far from over, but the quicker that we all, work together and get vaccinated, the quicker we'll be closer to the end.
And again, folks, if you do have questions, or actually we do have them in the Q&A, I just realized somebody's asking, what will be the protocol if the CDC staff refuses to do the vaccine? And I think they mean CDCR staff, maybe.
Yeah, I can jump in here really quickly, just from like having gone through that system before. Listen, they shouldn't make anybody take the vaccine, just like we shouldn't make you take the vaccine, and the government shouldn't be making anyone take a vaccine. Um, as far as like protocols in place, we don't know yet. Like we really don't have the answers, and neither do they, about the staff that are refusing to take it. It's you're right. This is something that you're putting into your body, and I want you to be able to have all of the information that's available to you to be able to make that informed decision. If I was offered the vaccine, I would 100% take it. If there is if I was inside still and they gave me the opportunity to take, I would 100% take it, just by the information that I know now. This isn't something that is just come on, like a particle in the wind. Like Taina talked about, they've done studies with Mars and SARS, and this is something that they weren't able to carry through, with those viruses, and they are actually ahead of the curve, in my opinion, about their studies and the effects of it. As far as like the long-term effects, we don't know, right? I mean, Mars and SARS were around for a while, and we haven't heard a whole lot of backlash on those two. And this right here is a similar method in order for them to introduce the vaccine. So like I said, again, I'm not a medical professional, and I don't sit here and purport to be. I know that my friends in there that are dying. I know that my friends in there are getting sick. And if there is a way for that not to happen, I'm going to be able to provide them, and I have the platform to be able to provide them the information to be able to change that. I'm going to. But ultimately, just like the staff and just like those inside, they have to make this decision for themselves. And this is the great part of being able to have that type of freedom. They get to make that decision for themselves. So there is no protocol in place right now where the staff have to take it.
And to respond a little bit more in depth to the question of what are the long-term side effects, there are no documented long-term side effects of the vaccine. There are documented long-term side effects of contracting COVID. Children who get it some of them are getting another mysterious disease that's being called MIS-C, and kids are dying from that, even if they didn't die from COVID. Folks who have survived COVID are reporting long-term effects on their heart and their breathing. So for sure, like this is something that if you get COVID, or even if you are asymptomatic and spread it to somebody unknowingly, there is a very good chance that there will be long-term health effects that will affect you forever. And so far, like no documented evidence that there is something about the vaccine that can have long-term effects. Like also, you know, as the documentary said, like they have been testing this, you know, for some months now. They tested it on tens of thousands of people, and what we know for sure is that COVID has killed, you know, millions of people across the world. And what we also know for sure is that as of now, there are no reported side effects of the vaccine. So for sure, at this point, it seems, you know, if you're just looking at the numbers, there is much more of a risk to not get the vaccine than to get the vaccine.
Awesome. And folks are wondering if it is known what brand of the vaccine that CDCR is using for folks who are going to be receiving it in their custody.
I'm not sure if it's Moderna or Pfizer. Do you know, Lee?
Yeah, Moderna is the one that's being offered to our folks that are incarcerated. And I heard that the staff, they have the option of either Pfizer or Moderna. It just depends on their personal medical preferences. And so, yeah, Moderna is the one that's being offered to the folks that are inside. And so far, it's been distributed in 3 facilities: Stockton, Vacaville, and Chowchilla, the women's section of Chowchilla, the SNF program, and D Block. And I've spoken to somebody that is in that block that has taken the vaccine, and she hasn't had any side effects.
And if folks have a condition such as hepatitis C, HIV, or cirrhosis, do we know if the vaccine is safe for them to take? Are we able to advise folks on that?
Do you want to go ahead, Lee?
Yeah, so everything that not only I've read, but I've listened to other doctors talk about, so far there's no side effects for those. But with any vaccine, if you have any type of allergies, or if you have any type of underlying conditions, you should absolutely contact your doctor and talk to them about it, and talk to them about the studies that have been done in the past, and talk to them about the data that they've already collected. These are ongoing processes with these vaccines, whether it was all the way from the measles and the mumps all the way up until what we're doing now. These are data that they collect from the folks that have different types of conditions as they take the vaccines. And so I personally can't like answer that question if there has been side effects, but I would say absolutely, you know, talk to your doctor and find out.
Thanks, Lee. And I think, Taina, I think when we started, you had shared a little bit about your experience with participating in the trials. One of our guests is asking what are some side effects that we can expect when receiving the vaccine besides the sore arm. I don't know if you're able to advise based off, you know, what you've been learning through your experience as a participant in the trials.
Yeah, so the only thing that I experienced was a sore arm. But I have been reading, you know, some reports, and it, you know, basically what happens when you get the vaccine, even though it's not actually a part of the virus, it's the instructions for your body to fight the disease. So when you get the vaccine, your body is saying like, hey, there's something here that shouldn't be here. So it's going to kick the immune system into gear to fight it. So for some people, that might look like getting a slight fever. That might look like getting a headache, fatigue, chills, you know, some of the effects of like actually being sick, even though you're not actually sick, you don't actually have the virus, but your body is preparing itself to essentially kick the ass of the actual virus if you get it. So everything that I've been reading is that, you know, for folks who have had more of those side effects, like the fever and the chills and things like that, they're gone after a day or two because you're not actually sick. It's just your body preparing in case you do come into contact with the real coronavirus illness.
Thanks, Taina. And there's also questions around concerns where, because it looks like folks have been hearing that every brand of vaccine has different side effects. So does it matter what brand one receives for the vaccine?
So I've only really been reading about Moderna and Pfizer, and they're both the same type of vaccine. They're both, you know, with the video referred to as the 3rd generation of vaccine, which is the mRNA instructions. So all I've been seeing is that it's like pretty much similar for the two of them. Sore arm. My best friend actually just got the Moderna vaccine, and she told me the same thing, that her arm was kind of sore and it felt like similar to when she gets a flu shot. But I don't know, Lee, if you know any more about that. My understanding is that because they're the same like kind of vaccine, that they're pretty much the same.
Thanks. And then there is a question around whether Initiate Justice will be collaborating with CDCR to provide the information that we're sharing with folks here to population and to staff, because their concern is that CDCR has been doing a horrible job in terms of educating folks on the inside. So curious from one of our guests.
Yeah, we don't. Oh, go ahead, Lee.
No, and so I'm not personally working with CDCR in this aspect. I have my own reasons of why I'm not, but we are working with other organizations that are in this field, other social justice organizations. And like I said, we sent in a 4-pager on frequently asked questions and a little bit of what we know about the vaccine, or what the data reports about the vaccine, and we've sent that in to 160 plus inside organizers that spread throughout 35 plus prisons in California, and they're going to be disseminating that amongst their peers and sharing it amongst their peers. And so that's what we have available right now to be able to share with them. And this right here, this is very important to us, and this is why we're having this webinar. Is like, you're the messengers now. Like, you're the ones that are tasked with this responsibility. We'll share the same documents that we share with them to you, if need be, and just give you the information that we have. CDCR has done a terrible job. There's no doubt about it, and there's a reason why there's so many lawsuits against them, and there's a reason why people are resigning. The chief medical officer resigned. There's a reason why people don't historically trust CDCR, and it's because they haven't been really reliable vehicles on giving information to the people that they're in charge of protecting. And this is another reason why, I don't want to get into prison abolition, but this is the reason why Initiate Justice is so passionate about this, and why we're so passionate about making sure that people have the right information about the vaccine.
Right. And the only thing that I'll add to that is every quarter Initiate Justice puts out a newsletter that goes to all of our members inside. So in March, we plan on sending out a newsletter to about 35,000 currently incarcerated people. So about 1 in 3 people within CDCR custody will be receiving a newsletter from us in the next month and a half or so, that will give all the accurate information that we have on the coronavirus vaccine at that point.
And one thing behind Taina, what she just said, and if your family member isn't a member of IJ, they can always sign up at the website, and we make sure that they get that that quarterly newsletter this next quarter when we send it out too.
Thanks, Lee. And we actually have folks who are wanting to know where can they themselves get the vaccine once they're eligible for it.
Yeah, that's something that you're just going to have to contact your medical provider about. I believe that each county has a list of where you can get the vaccine, and the counties have also identified who is a priority for getting the vaccine. So like I said, my best friend got it because she works in the medical field. So if you work in the medical field, or even if you work in a field where you're serving medically vulnerable population, or working in-home care services, you would also be a priority for getting the vaccine. So I would say, one, talk to your employer, because employers are giving out letters saying, hey, because of your job, you are a high priority for getting the vaccine. And then you can also, maybe just Google, seeing where vaccines are available in your county. There are a few counties that are doing mass vaccine distribution sites. Before we sign off, I also want to respond to something that I did see in the chat that said that the vaccine is not as effective at preventing the disease. It's only effective to reduce the symptoms, and that is just not true. The vaccines that have come out have been shown both to prevent getting coronavirus, and if you get it, reducing the symptoms. So both vaccines are shown to be about 94 and 95% effective at preventing you from getting coronavirus. But again, not 100%, nothing is perfect. So still do be as careful as you can.
Do we have time for one more question, Taina?
We need one more, yeah, then we can wrap up.
So in the Q&A, somebody had asked for incarcerated folks who test positive. Are we able to share what the protocol for retesting them is to see if they are negative?
I don't understand the question.
Yeah, me either. Or so I'll say I'm not sure that testing negative is a requirement for getting the vaccine. Like, I know it was a requirement when I participated in the trials because they wanted to test people who they knew didn't have it already. So that way they can, isolate and say, okay, if you don't get COVID, it's because you were vaccinated, not because you didn't have COVID before. It's not my understanding that they're saying you have to have never had coronavirus before to get access to the vaccine now. But again, I don't think I'm really clear on that question.
And I think we just got clarification on that after an incarcerated person tests positive and is moved to another building, folks on the outside can't find out when they will be tested again, so they get moved out of a COVID building. But that was just, I think, kind of clarifying the question. And then lastly, do we know any information about how the vaccine could affect those who are could affect fertility based on the question?
To my knowledge, this vaccine nor any vaccine has an impact on fertility. It's like completely different set of parts of your body. Yeah, well, that being said, I think, we can go ahead and wrap up, just to close out again, just like thank everybody for joining us. I hope that this information was useful and helpful. It was recorded, but we also went live on our Facebook page. So, if you want to watch the video again or share it with friends, you can visit the Initiate Justice Facebook page and access the video there. I'm sure that we'll be sending out this recording to all of our members on our email list. If you're not on our email list, feel free to visit our website, initiatejustice.org, and sign up and follow us on Facebook, Twitter, and Instagram for continued updates. But Lee, did you want to say anything to wrap us up?
No, just thank you so much for just sharing the space with us and being able to be open to having this dialogue about the vaccines. It is, again, I would just reiterate, it is so important to the folks inside. I know I've lost a couple of personal friends, and I know that I've had many, many friends that have gotten sick, and every one of them to a T has told me that they not only will take the vaccine, but they wish that it was available sooner. And so I would just say, please keep spreading the education that you learn about the vaccine, and make sure it's from a reliable source and not just rumor. Like my friend said that her friend said this type thing, and make sure that it really does have some validity behind it before we start doling out information. And that's important to us at IJ. We don't like rumors, and we don't like to start things that are untrue. And so thank you so much for sharing this space with us, and thank you so much for joining us tonight. And please, if there's any other questions that we may be able to answer, reach out to us at Initiate Justice. You can find us right there on the website. And just thank you again. We really appreciate you sharing space with us tonight.
Yes, thank you all so much. Have a great night. Stay healthy, stay safe. Bye.